Could you describe a core needle biopsy?
A core needle biopsy is a procedure that is more commonly done by radiologists, although some breast surgeons do perform that in their office. The core needle biopsy has two ways of being done, actually three ways. Patients can undergo a core needle biopsy under mammogram. It is called a stereotactic biopsy. And the reason to do it under mammogram is for lesions that are not able to be seen under ultrasound. So usually the way that patients end up getting a biopsy is by a couple of things. So patient has a palpable mass, comes into the office, gets a mammogram, and then they get a biopsy. Or the patient has a routine screening mammography that finds something, goes to have a diagnostic mammogram, and then usually they will do an ultrasound to make sure that they can see the area under ultrasound. So if the area is not amenable to be seen under ultrasound, the patient will be recommended a stereotactic biopsy. So it is usually done in a sitting position or in a prone position, meaning you're laying flat with your breast hanging over an area where they can kind of put it under compression. And that's how the two techniques of doing it for stereotactic biopsy. Usually it is numbing medication that happens in the area of the breast by the radiologist or the surgeon performing the biopsy. And then a needle is inserted in the breast and tissue is taken out. The second way of doing a core needle biopsy is under ultrasound. So let's say that you had a mammogram or you have a palpable mass that they can see under ultrasound. Patients are usually laid in a supine position, meaning facing upward. An ultrasound is done using sound waves with jelly. And then a needle, again, after local anesthesia is injected into the breast, a needle is placed and tissue is removed from the breast and sent to pathology. The third way of doing a core needle biopsy is under MRI. So let's say that you have a mammogram, an ultrasound, and they're all benign, but you have an MRI for your breast screening. Or you have bloody nipple discharge and nothing is found under mammogram and ultrasound, right? So they only see something under MRI. And usually those patients have to have a MRI guided biopsy. For all three cases, the sample is removed and sent to pathology, and usually it takes about 3 to 7 days for the results to come back, depending on the institution. The post-op care is usually patients can drive home. They don't require anesthesia. Most of them are done under local lidocaine and then numbing medication to the breast. And it's a very straightforward procedure where the downtime is really minimal.